Let's go talk to ADA's scientific session attendees to find out what new ideas or research are most going to impact people with diabetes in the future.
We're doing research on sex differences in type 2 diabetes. So I think it is kind of the future nowadays. Nowadays, like we think about applying sex differences in treating patients because men and women are different. So we have to find different strategies to treat either group. So we're applying sex-specific medicine for diabetes treatment. So I think this is very exciting.
So I'm really excited about the new implants you have detecting the low blood glucose levels, also obviously highs. But yeah, I'm following tight on especially the Eversense. I think it's really good for the users because they won't need to calibrate it that often. Now I'm not an expert in the topic, but obviously the implant will have a better way of coping with the natural place where it's subjected into the human body.
Well, I mean, one of the important considerations is just the sheer incidence and prevalence of diabetes and the fact that it's increasing so rapidly globally. It represents a real challenge to healthcare economies across the globe. So the ability to be able to manage diabetes efficiently and effectively is crucial. And so quantifying the costs and the outcomes in terms of things like quality of life is really important, both from the perspectives of patients as well as providers, payers and clinicians as well. So understanding the totality of the economic burden is really important.
The main thing right now going on as an endocrinologist for me is the continuous glucose monitoring system. That's, I think, the future. If you look at insulin pump devices, there's the new hybrid loop system. That's very exciting for the patients, where you can predict hypoglycemia and also be able to deliver extra insulin when the blood sugars are elevated.
I think there's a lot of research on sotagliflozin, which is a very good medication now for diabetes. And also there's been a lot of lectures about distress and diabetes, which is a certain condition that makes the diabetes control very hard nowadays. And also another thing is the new technology for diabetes. I think they are very challenging now. And so we are heading to a very good future for the new technologies.